While there is no real cure for the common cold, there are ways you can help reduce the symptoms, such as fever, until it runs its course. Choose pain-relieving medicine to help reduce the fever, depending on your age or the age of child who has the cold. There are also lots of home remedies you can use to treat your cold and fever, such as taking sponge baths, staying hydrated, and keeping the room temperature comfortable. If you or your child has had fever for more than days, call your doctor for medical advice. Steps method: using medicine to relieve your symptoms. Avoid giving cough or cold medicine to children under years. These medicines don't usually help with their symptoms, and they can actually cause negative side effects in younger kids like stomach pain or vomiting. Instead of using cough or cold medicine, look for children's pain reliever to help ease their symptoms, if desired. 1. It's especially important to avoid giving medicine to baby younger than months, as there is high risk of accidental overdose. This is because these medications are based on child's weight, not their age. Give acetaminophen to kids younger than months to help with fever. Acetaminophen, such as infant's Tylenol, is safe to give to your child if they're under months old. If you'd like to help your child's fever go down, look for infant's Tylenol at your local drugstore or big box store. Make sure you're using type specifically for children, following the instructions on the label to know how much to give them. 2. Follow the dosage instructions depending on the exact weight of your child. For example, the suggested dose for baby who weighs between 6 to 11 pounds, 2.7 to 5.0 kilograms, is 1.25 milliliters, 0.042 fluid ounce. 3. Wait the amount of time suggested on the instructions before giving your child another dose. Take children younger than months old to the doctor if they have fever of 100.4 degrees Fahrenheit, 38.0 degrees Celsius, or higher, and take children ages 3 to 6 months to the doctor if they have fever of 102.2 degrees Fahrenheit, 39.0 degrees Celsius, or higher. Use acetaminophen or ibuprofen for kids older than months old. To help treat fever in kids older than months, look for children's Motrin, children's Tylenol, or children's Advil. Only choose one to give to your child, and follow the dosage instructions to know exactly how much to give them. 4. Don't give your child multiple medicines with the same active ingredient. This could lead to an overdose. Use one medicine at a time to prevent combining the wrong ingredients. Wait the proper amount of time according to the dosage instructions before giving your child another dose. Kids ages months to years should go to the doctor if they have fever of 102.2 degrees Fahrenheit, 39.0 degrees Celsius, or higher. Take acetaminophen, ibuprofen, or aspirin for fever if you're an adult. Pain relievers that are listed as helping reduce fevers are safe for adults to take, such as aspirin, Tylenol, or Motrin. Follow the dosage instructions and wait the appropriate amount of time before taking another dose, as listed on the medicine's packaging. 5. Never give an aspirin to people 19 years old or younger because it can increase the risk of contracting Reyes syndrome, which causes damage to the brain and liver. Try using nasal drops or sprays to help with congestion. Nasal drops can be put in children's noses to help them breathe more easily when they have cold. Adults and children over the age of can use nasal sprays as well. Follow the instructions on the specific type of nasal spray or drops to know how to use them properly and safely. 6. Look for decongesting nasal drops or sprays at your local drugstore or big box store. Method: using home remedies. Drink plenty of fluids to stay hydrated. This includes things like water, juice, or drinks with electrolytes. Fevers often make you feel dehydrated, so it's important to continue drinking liquids throughout the day. 7. Stay away from caffeinated drinks, as these can make your dehydration worse. To soothe sore throat and help with hydration, drink tea or warm lemon water with honey. However, This is only suitable for adult and children over year. Never give honey to child under year-old. For kids, try giving them diluted fruit juices, Jell-O, or popsicles if they are not motivated to drink water. Give sponge baths to younger kids to help reduce fever. Fill tub with 1 to 2 in 2.5 to 5.1 centimeters of lukewarm water, or water that's roughly 85 to 90 degrees Fahrenheit, 29 to 32 degrees Celsius. Use clean washcloth to gently spread the water over their arms, legs, and rest of the body. If they start to shiver, take them out of the tub and wrap them in towel. Shivering can increase fever. 8. Sponge baths are useful for reducing fever if you or your child is allergic to pain relievers. Never use cold water or ice to help reduce fevers. These cause chills can make the fever worse. Using sponge bath for 30 to 45 minutes can reduce fever by 1 to 2 degrees. Stay at comfortable temperature by dressing lightly. Hiding under lots of blankets or heavy clothing won't help fever go down. Instead, dress in light layers that can easily be removed if you're hot or cold, and use thin blanket or sheet if necessary. 9. Adjust the room temperature if needed so that you're at comfortable temperature and don't need lots of blankets. Eat chicken soup to help loosen congestion. Chicken soup is common cold food because it's warm, contains protein, and actually helps loosen up mucus to help with any congestion you're feeling. Warm up chicken soup or different kind of broth to eat when you have cold. 10. Soups and broths are also a great way to stay hydrated as they are mostly liquids. Soothe sore throat by gargling with salt water or using lozenges. Mix salt with water and gargle to help relieve sore throat, or suck on medicated lozenges that help soothe sore throat instead. Look for lozenges or throat sprays designed to help sore throats at your local drugstore or big box store. 11. Children under years shouldn't use these methods. They likely can't gargle well, and lozenges are choking hazard. Take an over-the-counter medicine to help with your sore throat like ibuprofen. Visit the doctor if your sore throat isn't getting better after days and you have fever higher than 101 degrees Fahrenheit, 38 degrees Celsius. Run humidifier in your home, especially at night. This may help to loosen congestion and prevent sore throat from breathing in dry air. If you don't have humidifier, try taking warm shower and inhaling the steam while you're in there. 12. If you don't have time for shower, fill your bathroom sink or bowl with very hot water and lean over it with towel over your head. Inhale the steam for about 10 minutes to help loosen congestion. Rest as much as possible. It's likely that you'll feel more tired than usual when you have cold and fever. Try to sleep and take it easy as much as possible to help your body recover faster. Spend time napping, sitting and reading, watching television, or other restful activities. 13. This doesn't mean that you have to stay in bed the entire time, just don't overexert yourself by doing things like exercising or going lots of different places.